Now let's move on to the next syndrome, and that's Bernard-Soulier syndrome. This is caused by genetic GP1B deficiency. I told you that in primary hemostasis, these platelet needs to bind with von Willebrand factors in order to get activated. Now this linkage happens via receptors called GP1B. When we are talking about Bernard-Soulier syndrome, we are talking about deficiency of this specific receptor. Now, patients with this syndrome have mild thrombocytopenia, and also they have enlarged platelets, and that's because these platelets, they are a little bit immature, so they are a little bit larger. And some students correlate these enlarged platelets with the name BS, Bernard-Soulier syndrome, bulky Soccer's BS. So maybe that helps you to remind this a little bit easier. Let's move on to the next disorder of primary hemostasis, and that's Glazmann Thrombasthenia. That's due to genetic defect in G2B3A, and that's just another receptors. I told you in the fourth stage of primary hemostasis, we have aggregation, and for aggregation, there is a specific receptors that binds to fibrinogen, and then this fibrinogen binds to another platelet. If we cannot form this linkage between fibrinogen and platelet, we cannot aggregate platelet together, and we cannot form platelet plaque. So when there is deficiency of GP2B3A, this platelet plaque formation cannot occur, and we have Glazmann Thrombasthenia. Alright, another cause of primary hemostasis disorder is aspirin. So aspirin irreversibly can inactivate cyclooxygenase. We know that thromboxane 2 plays a crucial role in activation of different receptors, and when thromboxane A2 is lacking, platelet aggregation is impaired because those receptors cannot get activated in order to participate in aggregation.